Good morning. So I saw a New York Times front page above the fold article basically saying that protests in Italy caused a COVID outbreak. That's how they worded it. And the lie, the trick, the scam, the deceit, and it could be unconscious. Maybe they believe their own bullshit, but essentially what's being used is correlation, where two things happen at the same time, and it's assumed that it's causation, that one event causes the other, without any proof. That's where correlation is so dangerous, because it just pulls things out of thin air. It's like me saying, oh, it's been rainy the past couple months, and every time I wore a blue shirt, it rained. So obviously my blue shirt makes it rain. That's correlation. Whereas causation would be if some company had some new high-tech material and they put it in all these shirts, and then a bunch of people are wearing the shirts in a particular area. They go outside and it has cloud seeding technology, and it has low pressure inducing technology, and it causes clouds to form, moisture to come, and it starts raining. That would be like a legit causation if somebody invented something like that, where they actually tested it, they tried it in different areas, they had people take off the shirts, put the shirts back on. That would be legit causation, where you actually prove that one thing is causing the other, versus two things just happening at the same time. Have to completely isolate for whatever it is we're saying is happening, and prove that it actually is causing it, instead of just saying, oh, we got lucky, it's a coincidence, that kind of thing. Two things happen at the same time. And so that's what's being used. And so let's take a look. So here it is. New York Times: center of Italy's anti-vaccine protests is now a COVID hotspot. Now, 2 weeks later, Trieste has emerged as a center of something else, a COVID outbreak linked directly to those protests. I read the entire article. There's nothing in here that proves that there was a direct link. They don't show any numbers. They don't say how they tested the protesters before, and then they tested them after, and then they found that they didn't have COVID, and then they got together, and then they all tested positive. What'd they do? Arrest them all? Did they force them all to get tested before and after? How do they know who's a protester, who's not? No, two things happen. And this city, Trieste, happens to be a border town. And one of the people thinks that, it's a border town. There's lots of people coming in and out for all kinds of different reasons. So that it's an easy cherry pick to assign this place as a spike, even though they don't really have any proof. And they go on to say, it's worrisome, and ICU beds and all this, throw out all the big guns, all the scare tactics, whatever we can throw at it to scare people without actually providing any proof whatsoever. And here's the thing that other people point out, the ridiculousness. But the Trieste outbreak shows how an unvaccinated minority, so they're a minority, basically saying everybody else is vaccinated. If you're already vaccinated, if the majority is vaccinated, how in the world can a minority of unvaccinated people be a threat to you? If your vaccine works, what's the problem? And then they go on to say, oh, well, the unvaccinated people are getting so sick and they're swamping the hospitals, and then people who do the responsible thing and get vaccinated, then they can't get care when they need it. Well, that's bullshit. I did another video on the hospital beds and ICUs. It's just a trick. If you look at the whole hospitals in the area, they're not being overwhelmed. It's just a fraud. And down here, a pandemic of the unvaccinated, and it's massive. If the unvaccinated people are a minority, how can it be massive? They keep telling us that the majority of people are vaccinated. Well, if the majority is vaccinated and there's only a small number of people who aren't, then how can there be a massive threat? If the vaccines work, they should work. So here's a shot of the demonstrators against the pass. Looks like they're having a good time to me. Looks like they're just regular folks out enjoying the sunshine. And here this lady's playing a flute or recorder or something. And, where's the problem? And here's the real kicker. They say that we cannot allow a minority of a minority, referring to the protesters. We can't allow these protesters to come in and block business activities and people's livelihood for weeks. Then they cut to a picture of during the lockdowns, when the government basically turned the city into a friggin' ghost town, bankrupted thousands of businesses, and then they have, for how long? 18 months or whatever it is, and then they have the nerve to say that a minority of protesters are blocking business activities. Give me a fucking break. It's just the insanity. This is what passes as news. These are supposed to be journalists. You know, when I used to read the New York Times, I was always impressed with the quality of the writing. They were actual good wordsmiths, word crafters, you know. It was much better than the local paper, but this kind of trash, fear-mongering with no like logic, no critical thinking, just putting out scare tactics. It's absurd. Then here's another shot of like, I mean, these look like healthy people. They're biking, they're thin, they look fit. This guy's got a big smile on his face, you know, they're out in the sunshine. They just don't look like sick people to me. The biggest cluster, they say, emerged in 93 people. This is the big threat, 93 people. To me, what's absurd about all this is they highlight cases, again, tested positive. What does that mean? They don't say anything about whether were they sick? Did they feel sick? If they did feel sick, what was it? Fever? Did they have any symptoms? It doesn't mention symptoms or any sickness. Did anybody die? It doesn't mention any of that. Did these people even know they were sick? You know, that's the thing. I've gone several so-called cold and flu seasons without getting sick. If I was tested all the time, I probably would have tested positive, you know, like that's asymptomatic of like, this stuff is going around all the time. Viruses are everywhere. They've been with us forever. They're always going to be there. This nonsense about how like a positive test matters. No, it doesn't. It's ridiculous. And then, 93 people crammed together without masks. Masks don't work. I did a video on that. Sean Stevenson of the Model Health Show just did recently a really in-depth 2-hour debunking of all the mask studies. They don't work. Masks do not work. And cloth masks even show an increase in bacterial infections. In other words, wearing the stupid thing on your face traps moisture, and it's more likely to increase the risk of infection, which is insane that they're forcing kids to wear these in school all day, every day. You know, like no wonder they would get sick. You know, I know several kids who went back to school after the lockdown and all that, and one is an older kid, so he was vaccinated. He got sick right away. The kid's overweight, he has a terrible diet, and being isolated in a room without sunshine for months on end, and then suddenly exposing ourselves to all this, the world, nature, the earth. Well, how is that not a recipe to get sick? Living a super unhealthy lifestyle and then being thrown into a petri dish of all kinds of stuff. And just the stress of being at school. For me, it's a stressful experience in a large school. How can you not get sick? And so the CDC put out a similar correlation BS. They're really reaching to try to find anything to say that masks works, because they don't. Masks don't work. And so they have to make up shit, with BS, lying studies. I can't even call it a study. This is just a report of like a bunch of gobbledygook that doesn't make any sense. I read through it several times trying to find any actual science or data that actually proved anything, and it's just nonsense. It's just a bunch of crap. And so it says association between kids and masks. And somebody else who lives in Arizona actually wrote a thing kind of debunking this. And basically they were able to find a correlation. Again, not causation, but they had two things happen at the same time, where in one school district, mask policies were delayed, where in other ones they were earlier. And the one that had the delayed, they found some more tests in the area of positive COVID. Was it a huge number? No. Did the kids get sick? They don't say. So it's correlation. They didn't isolate for what else was done in the area. Did, distancing, whatever, all the stuff. Were the kids fat? Were they obese? Did they eat right? Were they healthy kids? They didn't isolate for anything. All they did is they went through and combed the numbers, found two things that lined up, and they're like, boom, okay, we can put out a BS study because we got this little cherry-picked data and we can claim causation, even though all it really is correlation. And there's no study here, there's no science, but they're so desperate, they just put out anything, knowing that people mostly just read a headline, get scared, and don't bother to read the fine print. And I read the fine print, I couldn't make any sense of it. So, someone who's just scared and not really looking to take a deep dive, how are they gonna find the fine print? They're just gonna go by the headlines. And my reason for doing this video is, the New York Times carries a lot of weight. Maybe not as much as it used to. I don't know what young people are reading these days, or younger generations. I don't read the New York Times or any newspapers. I don't know anybody in my age group who does. I know some people who watch, network news. The younger generation, I'm not sure where they get their news. Is there a trickle down of the mainstream press puts out something and then it ends up on social media or people parroting it, and that's where they get it, or it ends up in the school district adopts the New York Times or the CDC's like, mainstream narrative, and then it gets put out in schools, and so the kids just go along with it because that's all they know. For me, like the danger of all this, it's so upsetting to be like, man, this is why we're in this mess, because people believe this garbage. They don't actually look at it and question it. They just go along with it. So seeing it on front page on this major institutional newspaper, it's sad and it's frustrating. And I'm like, man, what can I do? Well, this is what I'm doing. I can make a video kind of going through it and highlighting what's going on here, like correlation. It's meaningless. It's like, without actually getting down to the details and experimenting and trying it, so it's just another tool out there for you, to highlight what's going on. And so like sometimes I read these stories and I'm like, wow, that's scary. And then I'm like, all right, I've seen in the past how this is total crap and garbage. And so like, but then trying to dig in and find the data, it's not there. It's like hard. So like trying to isolate where the BS is, where the lie is challenging. They're really good at propaganda, really, really good. That's why it works, because it's effective. Just put a bunch of stuff out there with no real proof, and then it makes it difficult to like dig through it and find where the thread is, where's the lie, and then so it takes a lot of critical thinking. It's a lot of work. So my hope here is to spread some more awareness and help us, give us more tools to debunk this stuff and get back to what really works, which is health. Being healthy, eating right. Here and where I live, we're going into winter, and so I'm doing my best to get more sunshine, get more rest. Eat foods that have high in vitamin D and vitamin C, and just be nourished. Take care of myself, because that's where health comes from. Yeah. So hope we can all get together soon. Thanks for watching.